So, Dr. Howe, thank you so much for joining with me in my interview. So, I have some questions to you. My first question would be like a few minutes ago, I have a tour of your clinic, and that brings me to my first question. That is, this is a multi-specialty clinic, and what inspired you to practice in this type of model?
Now, that's an excellent question. I have to start by sharing my international experience. So I am born in Malaysia, right, in Kuala Lumpur. But however, my education I received in Singapore. Right, so therefore, when I come back when I did my postgraduate study, I did it in London. All right, then I also have exposures in United States, Switzerland, and Germany also. So, and then ever since I come back to Malaysia, then I actually joined Malaysian Dental Association, and I served my way all the way up as a president. So throughout all these years, about 20 over years of experience, I have a lot of international exposure. So as such, right, I wanted to bring the high technology, my international experience to Malaysia. And that's why I set up this clinic.
Wonderful. You have a strong background in orthodontics and smile transformation.
Yes.
So when you plan for a treatment, like what the basic thing you keep in your mind to transform a smile?
Yes. When we talk about transforming the smile, right, a lot of people just look into the smile per se, but what we have is actually to look into the jawbone first. Then we look at the teeth, and the third thing we look into the soft tissue, which means the lips and the cheek also. So therefore, with that, right, orthodontic play a very crucial role, because orthodontic, right, we can not only move teeth, but through the movement of teeth, we influence the jawbone as well as the lips also. Yeah, so that's why we feel that we can do a much better and much more profound smile transformation.
Okay. So what I have learned, like you have moved from single specialty practice to multi-specialty practice.
Yeah.
So what do you think, how multi-specialty practice is now creating effect on single specialty practice?
That is a wonderful question, sir. Now, a single specialist practice, right, is what we call interdisciplinary. Specialist we call multidisciplinary. So when the old concept is that when you see, let's say I'm an orthodontist, if you wanted to do some orthodontic treatment, you see the orthodontist. Then if the patient required to do a scaling, then he go and see a GP. Then the patient required to do an extraction, then go and see another person. Yeah, and then so therefore, for one patient, they have to see so many specialists in order to get things done. Whereas interdisciplinary is that, right? If we can combine everything together under one roof, meaning that a specialist center, or it can be under one doctor or a few doctors, but all within one roof. So meaning that the patient does not have to be referred from one end to the other, and that will actually consume a lot of time and also a lot of costs incur also. So therefore, we believe in patient-centered. So we are able to provide a quality specialist center standard. At the same time, we are able also to bring the cost down, and then we can give the convenience to the patients also. So I think that in my personal opinion, of course this is debatable. Yeah, some people may not agree with what I say, but at least that's truly what I believe to offer the best value for money for our patients.
Oh, wonderful.
Yeah.
For the last few years, you are having so much responsibilities, and as far I know, you are involved with so many dental organizations. You have some leading role in that organizations, and as well as you are running this kind of dental chain in Malaysia and Singapore. So, how do you manage all these things?
Oh, actually, this is another excellent question. I think whatever you want to do, right, the first and foremost criteria is you must be passionate to do it. So once you're passionate in doing something, then you will be able to prioritize what's important. And when also that I always believe that when you're passionate doing something, you have endless energy, that you don't feel tired. You're always able to move one thing to the next level. So I believe there's the thing about the secret to it is that, right, is being passionate to have a very noble intention of what you want to achieve in life. Yeah.
You were so much passionate about delivering your knowledge or disseminate your knowledge, and like I have never seen a clinic with a wonderful organized training center. And I also know that you are lecturing in different places in the world. So what are the key messages you want to deliver to the young dentist to be successful in this profession?
Thank you. First of all, right, as I mentioned about passionate about it. Second is that you must dare to dream. Yeah, dream what you want to achieve in life. And the thirdly is that, right, must not afraid of failure. Right, because failure is actually the success, is a precursor to the success. So therefore, I've gone through many failures in my life also, but I persisted on my dream and I persevere in my efforts. Yeah, so that's why through repeated failure and repeated refining and re-examining why we fail, yeah, then I think your dreams will be a step towards success. Yeah, so I do believe that all the young people need to dare to dream, yeah, and pursue their dream goal.
Okay, so that would be my last question, but it's the meaning of the question is huge. Like I have seen this clinic has been ranked #1 clinic in Malaysian dentistry, even in global rating. As well as you are working with dental tourism, like people from all over the country are coming here, all over the world are coming here, and they're getting treatment. So what is your vision in dentistry? What do you want to take your practice in which level?
Very good questions, huh? I always believe that dentistry as a profession should not be too commercialized, because as a doctor, right, we must have the compassionate and loving kindness heart as a doctor. So therefore, I'm very so-called self-indulgence into excellence. So what I really want to build is that, right, is to create a so-called a model in which we can pursue excellence and then make every patient very satisfied with our services as well as the clinical outcomes. At the same time, make it into affordable price. So therefore, my thinking may sound a little bit too noble, but indeed that's true from my heart, that I feel that I see many practices much bigger than me, much more successful than me. But then, if you ask me whether I like to be like them, I would like to be like them, provided that I do not actually compromise my dreams. Yeah.
Okay. Thank you. It was wonderful talking with you.
Yes.
It's a wonderful session. Thank you so much for
Thank
joining
you so
me.
much. Thank you so much. It's a great pleasure. Yeah, meeting you. And thank you for traveling all the way from Bangladesh to here. Thank you so much.
You're most welcome.
Yeah.